And I will be performing today the surgical hand washing. First, assess your hands for visible soiling and check for possible breaks or lesions in the skin or cuticle, and then assemble the equipment. Remove your rings, cheap nail polish, and watch, and then pull up your long sleeve above your elbow. Put on your cap, shoe cover, and face mask. But for this video, I will not be using face mask for a better audio reception. Use a deep sink with a side foot pedal. Assuming that our sink has knee or foot pedal, I will now be turning on the water to regulate its temperature because you do not want the water to be too cold or too hot, because if it's too hot, you'll get burns. The water temperature should be warm to promote the removal of microorganisms in our hands. Next is to wet your hands starting from the tip of your fingers down to your elbow. Remember that in surgical hand washing, you should remain sterile, so you should always put your hands above your elbow and not lower than your waist level. Also, step away from the sink because you do not want yourself to get contaminated. Next is to apply soap to the soap brush or open the pre-packed scrub. Get the nail pick and pick your fingers under the running water. And then discard the nail pick. Now lather the soap in your hands. Using the brittle side of the sponge, scrub your fingertips first. So you should do this 10 strokes. And then do a circular motion at the palm of your hand and to the dorsal area. Dorsum. Now let's proceed with your fingers. So imagine that your fingers have 4 sides. So you do this 10 stroke each. Okay, now imagine that your arm is divided into 3 sections. So you will do a circular motion strokes here on each sides of your arm. Next. So repeat the procedure on your dominant hand. After scrubbing our hands, we are now going to rinse our hands into this running water, starting first from the tip of your fingers. Okay, make sure that there is no soap to be left in your hands. And always keep your hands above the elbow. Okay, also do it on your other hand and turn off the water. Then, as I've said earlier, now you are considered sterile, so always keep your hands above your elbow and not lower than your waist level. You are now going to proceed to the operating room to dry your hands. Keep your hands flexed and remain in this position In opening the operating room door, you can use your shoulder or your back. So you do not want yourself to get contaminated because now you are considered sterile. So now we are going to dry, assuming that we are on the operating room, and we are now going to dry our hands. So first, grab the sterile towel or clean towel using your hand at the edge. So putting it into full length. So now, this side, we're going to pat dry. Starting from the top, of course, of your hand. Okay? And then next, grab the towel here at the bottom side and then turn it over, flip it. And use the other side in pat drying the other hand. And now, you can discard your towel into the linen hamper. And for the evaluation, inspect your hands and fingers for cleanliness, and don't forget to record the time when hand washing is done. Thank you, sir. Have a good day.